Hello everyone, good evening and welcome to the orientation session of MRCOG courses part 1 online course. So today we are going to talk about how to prepare for MRCOG part 1 and how you need help in this, and with the help you can actually do it in one go. So the basic thing is that we all know that there is a huge amount of fee which we deposit for the exams. And first of all, it is a big decision to take that you are now going to do this MRCOG degree. So therefore, when you have taken such a big decision, you should have a right way to pass this exam, right? So basically, first, let me welcome you and let me congratulate you that you are able to take this decision, that now you are ready to do the MRCOG, which is one of the very respected and gold standard qualification in the career progression of OBS and Gynae. So I congratulate you and I welcome you to this session. So here we are going to talk about how we are actually going to prepare for the part 1 exam so that we are sure of our success. So this is congratulations and wishing you all the best, all the very best for this. Now, the important dates for this January 2023 exam is already the eligibility deadline has been closed. It is 30th September. So I think I'm quite sure all of you who are here must have done your eligibility till now. Expression of interest closes Friday, 14th October 2022. So if you are planning for the January exam, then last day to fill your expression of interest form is 14th October. So please do it as soon as possible. Then booking window will open on 10th November. All those who have filled their expression of interest form will get a booking token for the booking of exam, and it is 10th November. So on 10th November, you will receive a mail in your email ID which you have registered with the RCOG, and you will have to select the center and book your exam and deposit your fees. So be very particular about this date and mark this date in your calendars. Window application will close on the booking window application closes on 15 December. But my recommendation is that please don't wait for the last day. Do it as early as possible, right? So try to do the bookings as early as possible, so that you get a center of your choice and you get your seat, because booking token actually does not give you the 100% surety that you will get a seat unless you book it. Okay, so don't wait for too many days. Try to book your seat as early as possible. Okay, so whenever you are booking your seat, you need a good internet connection and a credit card which works on an international basis, so that you can deposit the fees then and there. So you have to mark these two dates in your calendar. 14th October for expression of interest. If you have not filled till now, please do it today only. And then mark the 10th November to book your exam seat. Finally, results will be released on 21st February, and I promise that would be a very happy day for you. So let's see how we are going to progress, how you can take advantage of this whole course, and what actually this the MRCOG part 1 holds for. Okay, so what things you have to prepare in part 1. So part 1 MRCOG basically assesses the scientific platform for clinical practice. It examines the 15 core knowledge areas in 4 domains of understanding. This part I have directly taken from the RCOG website, and it is clearly mentioned there in the website. So why I have taken this? Because I want to highlight what all things we need to know. So we need to know understanding cell function. That means we incorporate physiology, endocrinology, and biochemistry in this. So 3 subjects under this domain, understanding cell function. So physiology, endocrinology, and biochemistry. All these 3 subjects are part of paper 1 usually. There is no clear distinction of subjects between paper 1 and paper 2. There can be overlap slightly, but largely they are defined. Understanding human structure, this incorporates the anatomy, embryology, and genetics. Understanding measurement and manipulations. So all our techniques which we use for diagnosis and management are incorporated in this. So biophysics, epidemiology. Epidemiology includes the natural course of diseases, and statistics, data interpretation, how you interpret your reports, and pharmacology, what drugs you use for the management. Understanding the illness. First, we have to understand what the illness is. So first we have to, starting from what is normal, that we will study in first 2 domains: anatomy, embryology, genetics, physiology, endocrinology, and biochemistry. We need to know what is normal, how the cell or the body or the organ functions naturally. Then we move on to the illness. Okay, so what is abnormal? So immunology or microbiology or pathology and clinical management. So these take care of your abnormalities or the illnesses. And finally, how you are going to diagnose and what management options are available. That is your understanding, measurement, and manipulation. So like this, it is starting from the basics and takes you to the management part. Okay, so when we talk of the data interpretation and clinical management, we have been managing things by whatever guidelines or whatever things we are following in our country. Okay, so but here we have to take the RCOG viewpoint. You have to develop a vision for the RCOG, so that when you know how the RCOG would deal this case, okay, then you get that vision, and that is by reading the guidelines provided by the RCOG, which are green top guidelines and NICE guidelines. So green top guidelines and NICE guidelines in detail is a part of part 2 exam, but for part 1 definitely you need some of these things. So when you yourself go and search what all you have to do, you have a huge bundle of guidelines. So we provide you with some summaries so that you can just read whatever is required for the part 1. And by reading those summaries, you get an overview of how to answer the questions for part 1 exam. So all these subjects, now you know there are so many subjects we have to cover or you have to study for part 1 exam. So this all will make up a complete syllabus of part 1. What is format of MRCOG part 1 exam? The test paper is computer-based test. Of course, you cannot do it from the home. There are centers allocated and you have to go to the center, and from there you have to do an online exam. So there are 2 CBT papers which consist of 100 single best answer questions. Now each paper counts for same amounts of marks. Paper 1 counts for 50% of overall mark, and paper 2 also count for 50% of the overall mark. So from both, whatever you have scored, those score will make up 50% of your total result from the paper 1 and 50% from the paper 2. Together they will be combined, and in together you have to have a marks which is above the passing cutoff. There is no fixed passing cutoff. It is determined by how what is how about the paper, what is the difficulty level of the paper, and how the students have attempted that exam. So it is a relative thing and it keeps on changing year on year. Usually it is somewhere around 65%, but it has gone up to 69 also, and it has remained up to 62 also. Okay, so there is quite a variation. So what I tell my students is, when you are practicing for your exam, please take the cutoff as 75%. Okay, so when you are attempting your assessments, you are doing your mock exams, or you are doing your practice, keep the cutoff of 75% in your mind. Okay, because if you are regularly performing above 75%, then it is almost 100% sure that you will be performing above 70% in RCOG, which is required to pass the exam. Okay, so you are well above the cutoff value, and the enough margin you require to assure your success is there. So this is a dictum: whenever you are practicing, try to reach beyond 75%. And let me tell you, it is easily achievable. If just by putting in some amount of consistency, it is easily achievable, particularly if you get a right guidance and you are focused on what to study for the exam. Now, this is the timetable of the exam day. You have a paper 1, which is 2.5 hours duration, 150 minutes, and number of questions is 100 SPAs. So you see that you don't have more than 1 minute or 1 minute 30 seconds for the each question. So not much time is there. You have to read the question and you have to understand and answer is. So actually you cannot count complete 150 minutes, because finally some time to 10-15 minutes is finally needed. So as to make this all perfect to present. So better is to keep as 120 minutes safe side. And you see that you have almost 1 minute for every question. So you have to be quick. This comes with when you are regularly practicing your assessments, you have done your mocks, so you are very quick in answering, and now you are in a practice of reading the questions and answering in a given period. So this all is by a computer-based test practice, which is provided to you in a similar exam-like format. Then there is a lunch break of approximately 1 hour, followed by a paper 2, which again is a 2.5-hour exam with 100 single best answers, right? Now, let's focus on what are single best answers. So now you see that it is not just single answer questions. This is single best answer questions. So what is the difference in this? In this question, you have a stem or a case scenario and a related question which is given to you. Followed by, there are 5 options, out of which one is a best answer. I didn't say that one correct answer. There may be 2 answers which may seem correct to you, but you have to choose best out of that. So single best answer from the RCOG's perspective, from the college perspective, is what is required. Okay, so single best answers. Now, let me read this stem for you. So 24-year-old presents at 27 weeks into her second pregnancy. She is unwell with backache, fever, rigors. She has a temperature of around 38. Urine analysis shows leukocytes and protein plus. Her blood pressure is 80/50. Which action is most appropriate? So admit to ICU HDU for intravenous antibiotics and supportive care. Arrange ultrasound of renal tract. commence 7 days course of oral antibiotics, give intramuscular steroids to promote fetal lung maturity, make referral for physicians to review. Now, this is a pregnant patient into 27 weeks. So, of course, this is a premature baby, but she is into sepsis with blood pressure of 80/50. So, would you like to answer what actually would be the most appropriate action? You can just try that. Any one of you can try that. Which action is most appropriate?
Number A option.
Yes, correct. Very good. So why you chose this option? Any reason or explanation behind it?
Because she is in septic shock, it seems, and she has to be admitted in ICU for further management, for vital charting and input-output charting and IV antibiotics and supportive care.
Yes, correct. Very good. So it's a very good answer she has given. And this is Dr. Palve. Very nicely she has explained that blood pressure is 80/50 and all signs of sepsis are there. So this is most likely she is in a septic shock. Actually, this is severe sepsis. We right now cannot say septic shock because the definition of septic shock is that the blood pressure cannot be regained by the IV fluids also. Here we don't know whether the IV fluids have been given or so, but severe sepsis, so she needs to be admitted into ICU and HDU for intravenous antibiotics and supportive care. Very correct answer. Although we need to do remaining things also, like we would arrange the ultrasound of the renal tract because she is most likely having pyelonephritis. So she would need further investigations. Steroids is also required because if we need to deliver at 27 weeks, it is recommended. And of course, physician's review or critical care specialists are also required. But again, this is the concept of single best answer. So you have to choose what is to be done most appropriate at this moment. So first she should go to ICU, HDU, and then further on, we can investigate her further. We can take up a help of multidisciplinary team, which will involve further specialists. And we can see that if we want to deliver or whatever we have to do. So this is single best answer. So A is a correct answer. Similarly, this is regarding CTG analysis, which is accepted normal range for variability. 1 to 5, 1 to 15, 5 to 15, 10 to 20, and greater than 15 beats per minute.
C.
Correct. So this is, in this case, the answer is very obviously, it is a numerical value. So it is a fixed answer. So you can have like this questions also in which there is some fixed value. No confusion. Most of your anatomy questions will be like this only, okay? Because anatomy, your findings are fixed. Like this is a branch of this nerve, or this vessel is a branch of this major artery. So it is fixed. So like this type of questions are very, very scoring questions. There is no confusion about it. So we need to be very perfect with such type of questions. So this is just to give you an idea what type of questions we can have in our exam. Now this is syllabus with various subjects in paper 1 and paper 2. There can be an overlap between the subjects, but largely the paper 1 consists of anatomy, biochemistry, embryology, endocrinology, epidemiology, statistics, genetics, and physiology. Paper 2 consists of biophysics, clinical management, data interpretation, immunology, microbiology, pathology, and pharmacology. So we will be talking of all these subjects one by one, and we are starting right now from the anatomy subject. Now, why I have kept all this in this orientation session? Because I actually want to give you an idea how much time we need to spend on any particular subject. We are targeting our January exam, which means that we have to finish everything by 15 December or 10 December, and then we should have 1 month of revision in our hands. So how we are going to divide, and everybody of you is working, so you don't have a time like you used to have in your MBBS days where you will just sit with the book and spend 24 hours with the books. We don't, any student, I don't think has any time. Everybody is busy with the studies, maybe some has families also. So large number of things around. So I just want to make you so that you have an impression in your mind how much time you are going to spend for each subject. Anatomy is a subject which gives you around 15 questions. 15 or maybe up to 20 questions. Okay, so it is 15 to 20 questions. And as I said, anatomy is a very, very scoring subject, because if some answer is fixed, that is fixed. Anyway, they are going to ask you, the answer will remain fixed. So if you know the particular thing about that vessel or that nerve or that particular like triangle, like femoral triangle or like diaphragm openings, so if you know about it, then you are sure, you can just go and tick it and score your marks. So out of 100 questions, 15, 19 question makes a lot of difference. So anatomy, it's a very, very important subject in a paper 1. Now, another important subject is endocrinology. Endocrinology, again, endocrinology and physiology will together have around 30 questions, right? So we are going to spend 1 week for endocrinology and 1 week for physiology, because we want to go into depth of it. Endocrinology actually requires in-depth understanding, because it is a bit of confusing. But if you are, take the concept very clearly, then it becomes very, very easy, and it also becomes very scoring. So anatomy, endocrinology, and physiology, these are the subjects which will make up around 50% of the paper. Now coming to epidemiology and statistics. Very often students try to leave the statistics, or they think that they can just do a few things about it and just do few questions and they can score on the statistics. But please don't do that. Statistics is a very important subject, and 20 questions you can expect from the statistics. So now you see, if you are going to leave the statistics, you are leaving almost 20% of the paper. Okay, so then it becomes very difficult. So you don't have to leave the statistics. It is not at all tough. We will have a very nice session on it, and I promise you will be able to do all your questions very nicely. But don't keep this in mind that I am going to leave the statistics. Many of the students I see over a period of 4 years or something where I have been teaching. So many students come with the idea that they are not going to do statistics. So please don't do that. Don't try to go to exam hall without doing statistics. Okay, that would be a biggest blunder anybody could make. So we are going to do the statistics, and we will do it very, very nicely. Now the remaining part of the paper will be covered by embryology, biochemistry and genetics, and of course some of the questions from paper 2. So around five questions from all of these. Biochemistry questions, genetics questions, they are very often repeated also. In genetics, pedigree analysis is a very important thing which we need to know. So my main key message here is don't think of leaving any subject. Okay, we are going to touch all of these things, and in depth we are going to do these things. So we have to spend time on all these. So we will be spending almost 1 week on anatomy, 1 week on endocrinology, 1 week on physiology, and 1 week on genetics. For embryology, I have kept 1 week because we are starting from anatomy and embryology. So I want you to be in the flow. But for biochemistry, we will have 3-4 days. And for genetics also, we will have 3-4 days. Okay, so this is the way we are going to do. Now, one more thing I would also like to tell you about the paper is that, like, it has 100 questions, right? So 60 questions will be very simple. They are direct questions. If you have read it, you will be able to tick mark it immediately. 20 questions will be which are really a testing questions, which will make you fail and pass. They are average questions, right? With they are normally asked concepts with a small amount of twist. So if you are able to take that much amount of twist, which usually you are because you have been practicing with the assessments. So if you are able to take up that much twist and you can still decipher the question, it has normal things which are asked, but they are asked in a slightly different way. So if you can manage those questions, you pass, right? Remaining 15 questions or 10 questions are a bit which are very, very much out of the things which we usually read for the part 1. Okay. So we don't have to focus on those questions, right? Because they are sometimes too much vague to be covered. If you go and try and to cover those 10 questions, you will be reading too much and then you will be forgetting what normal things we had to remember. Okay. So we are largely focusing on 85 to 90% of the paper, out of which, as I said, we'll try to keep our performance above 75% in any case. Okay. My humble request is that please don't take any answer of the question like to cram that answer. Okay. If you are not clear with any answer, please do ask it twice, thrice, 4 times so that you build the concept behind it. Because questions are repeated, but the language is not repeated. Concept is repeated. So if your concept is good, you will be able to solve the questions, right? So wherever you find any difficulty, you are not able to build up the concept, do ask it and clear it. Okay. Now coming on to paper 2, biophysics, clinical management, data interpretation. Clinical management data interpretation largely requires the use of guidelines. So when we will be taking the pathology, I'll be taking up clinical management and data interpretation simultaneously, because pathology is what? The pathogenesis of the disease. Finally, how the disease progresses, what is the sign and symptoms, that is a part of clinical management. What investigations you do, that is data interpretation. So these all 3 subjects are very much linked, and these 3 subjects will make up 60 to 70% of your paper 2. Okay, so huge chunk from pathology, clinical management and data interpretation. Out of this, oncology itself is a very, very big part. Then your microbiology and pharmacology would be around 8 to 10 questions each, and immunology and biophysics in remaining 10 questions. They together will make up around 8 to 10 questions. So like this, we are going to cover almost all the subjects. Whatever I have told you, it is depicted in this diagram. You can see the major chunk of paper 1, anatomy, endocrinology, and this is statistics and physiology. So 4 big chunks you can see here. Similarly, here it is clinical management, data interpretation, pathology. So these are again big subjects. Difficult modules which can bring you down. Actually, difficult, I won't term it as difficult, because once you know, nothing is difficult. Once you have studied, it is good. But these are the subjects which usually people face some type of difficulty. Statistics, endocrinology, and genetics. In paper 2, clinical management, data interpretation, and pathology. This usually becomes difficult if you are not aware of the RCOG guidelines. If you try to answer it from your practice, then usually it is not correct, because we actually in our practice are not following which is meant in green top guidance, because we all are following what is being done in our countries. So we have to develop that RCOG viewpoint to answer these 2 subjects. Now, books recommended by RCOG, if you go to the RCOG's website and you see, this is the books they have prescribed or recommended for the part 1 exam. So basic sciences and British formulary and all these, and then this is a long list. Now, I would like to tell you that when I did my MRCOG, I could not get many seniors around me. One very good senior was there who definitely told me about some books, but by the time actually she had did it long back, so many things had changed. So I actually ordered the new Harper, the new Genong, and all these books to study. But finally, what after my experience, what I could come to know is that there is no use of going and reading such books, such big books, because if you really go through all this, you are not actually concentrating on the things which are asked in the exam. You are actually reading big books, nothing helps. So how do you feel looking at a long list? Of course, too much confusion, but yes, when we step in, things change. So how do the course helps? I'll provide you with the upload videos. You will get your videos in your daily routine. We'll be sending you one by one video. Okay, we are not providing all the videos together to you because this is like a guided tour type of a thing. Okay, so one by one we are going to do that, and every day you just try to spend 30 to 45 minutes for the MRCOG part 1 study, right? So every day you have to go through these videos. Finally, after you have received some videos of that particular subject for few days, then we will do a live session in which we will discuss all the important points of that subject which are required for exam. So live session, please do try to attend the live sessions. Because that is going to be a quite interactive. We are going to solve questions and you have all the opportunity to ask whatever your concerns are. Although the Telegram course group, which I have created, is open. You can always ask your queries. My number is also with you, so you can always text me. But it is good that you ask in the group, so that everybody will learn from each other's queries, right? So we can discuss the queries in live sessions as well as course group. Then there is assessments and mocks, which we are going to do. So assessments and mocks will be like, there will be smaller assessments in between. After every subject, there will be an assessment. Okay, sometimes I can give you just a 10-question assessment in between also. Daily, I am posting questions in the Telegram group. We can discuss there those questions. We have live question discussions in the Telegram group also, so that we are together at that particular time, and I am posting, you are answering. If at all you miss the live discussions, my request is that at least at the end of day, do go through that discussion, because when we discuss, many important things are being highlighted, and this is the only way of fixing things in mind. RCOG is not like you just take a 1 week leave or 10 days leave or 1 month leave. Nothing is required. Okay, if you are slowly building up things in your mind, then you can easily do it. Then we also have summaries. Whatever we will be teaching, we'll provide you with a summary in a PDF form in the group, so that you have a written template also there. Revision notes part 1, already I have sent you all a PDF. So we will be going through this PDF. This book will be your Bible, and you have to read this book. Largely go with the notes, whatever I am providing you. At least for the smaller subjects, you don't have to need even the books. But whatever things you have to read, you can use this Oxford revision notes. Essential revision guide is a very big book. Not much required, only like sometimes some people may find difficulty in understanding from the points. Of course, I'll be clearing all those points. So it is very less likely that you will feel anything to be cleared. But if you really want to go and search something in detail, then you can use your essential revision guide. So how course prepares you for a beautiful destination? This is the route we are going to follow. First, start with listening to uploaded videos. Then we do question practice. Finally, we have an interactive live session where we will discuss. Then we have practice assessments and final mock. And finally, you can achieve your destination. This is the thing we are going to follow for the anatomy. Video session, 1. Tomorrow you will get this video, which will contain anterior abdominal wall, umbilicus, inguinal ligament, and femoral triangle related content. Video session 2, after that on 12th, that will be about thorax, diaphragm, aorta, breast, and IVC. Then video session 3, which is 13:10, you will get with the posterior abdominal wall, lumbar plexus, sacral plexus, and nerve injuries. Video session 14:10 will be about gastrointestinal tract and urinary system. So once you have covered this in videos, in live session on 15th, which will be on Saturday at 4 p.m., we'll be talking about important topics: pelvis, perineum, female reproductive tract, male reproductive system, anatomy of fetal head, and arterial injuries. When you are watching the videos, I'll post the PDF also simultaneously. So you can, if you have time, you can keep a template in front of you also. And is in the video, somewhere you will find a red pointer also. That points that this is a particularly important thing which you have to fix in your mind. After we have done all this, then there will be assessment for anatomy on 1910. So like this, we will be covering all our course. The purpose of making it half video and half live is that nobody has a time to sit for such a long time. So if you have a 30 minutes or 20 minutes video, you can listen it while you are traveling, on the go, while you are cooking in the kitchen, or so any time when you are sitting or you get time, you can listen to that video. So you don't have to spend so much time with me sitting here. Second is that you can do it at your own pace and own convenience. I don't want to give things in a big chunks as a junk. I want to make it small, so that small things will pile up to make a big success. How can you get maximum benefit from this? Be with the schedule. Try to be consistent by taking out 30 to 45 minutes every day. Try to participate in good group practice as much as possible. Listen to videos and read summary PDF provided to you. Solve all your questions by posting in group or asking in live sessions. As I said, wherever you feel confused, ask is twice, thrice, as many times. So basically, another very important thing, which is very, very important, is that you need cope-up strategies, because many a times things will go wrong in between. Sometimes you have something at home, sometimes at duty, sometimes you feel demotivated. So this group participation and a constant support will, from my side, as a friendly gesture, will help you cope you through this all difficult time. Of course, I'm going to make it very beautiful rather than being a difficult time. So I'm not going to tell you to get over it, but I'm going to help you get through it. Any questions from your side? 100% from me and 100% from you will make it winning 100%. So help, support, advice, guidance. This is all we are going to do and work together as a team. Now session is open for your questions. Any questions you have, you can ask me. So from tomorrow onwards, you will get in your Telegram group the links of the videos. And I would suggest, as you get, please try to do it on that particular day. Okay. And simultaneously, I will be posting the questions related to that in the group. So please keep answering so that you are well versed with the theory. Yes, anything you guys want to ask, any questions or any feedback you want to give, anything specific, session is open. You can unmute and speak. How do you find this plan? Do you find it comfortable, friendly?
Yes, ma'am.
Okay, so can we finish the session for today?
Yes, ma'am.
Okay, okay. So
thank you so much.
Welcome. How do you feel, Dr. Obar? Are you fine? Fine with the plan?
I'm good. I'm just on the road. That's why I've not been talking. I'm on the road. Yes.
Okay. So we'll keep meeting from now onwards, and from tomorrow, please do check the group and do the videos, whatever being provided. And Saturday, we'll meet again live back. Okay. So bye-bye,
Okay,
and
ma'am.
thank you so much for joining.
Thank you so much. Thank you. I
Thank you,
appreciate
ma'am.
Thank you. Have a nice day. Have a nice day.
Thank you. You too, ma'am. Bye.
Bye.